Welcome to our deep dive into the world of VP shunting.
Okay.
Specifically, we're going to be looking at how it's used in animals with brain tumors.
Right.
You shared with me a recent article,
Yeah.
Ventriculoperitoneal Shunting for Brain Tumors by Catherine Russell and Simon Kornberg.
Yes.
It was published in Veterinary Clinics of Small Animal Practice.
Uh-huh.
And we're going to be focusing on how this procedure, VP shunting, can help with a common but often overlooked complication of brain tumors,
Right.
obstructive hydrocephalus.
Yeah. So obstructive hydrocephalus is a condition where the normal flow of CSF in the brain, cerebrospinal fluid,
Right.
gets blocked.
Okay.
And that leads to a buildup of pressure inside the brain's ventricles.
So even though we hear a lot about the direct impact of the brain tumor itself, this buildup of CSF
Yes.
is a separate issue that needs its own specific treatment.
Absolutely. And the interesting thing is that the article highlights that certain types of brain tumors are more likely to cause this problem than others. So for example, tumors that start within the ventricular system itself, like choroid plexus tumors or ependymal tumors, they're prime suspects because they're right in the path of CSF flow.
It's just in the wrong place at the wrong time.
Exactly.
Now, what about tumors that are located outside of the ventricles?
Yeah,
Can they also cause problems with CSF flow?
absolutely. So think about tumors that are in the caudal fossa,
Okay.
the area at the back of the skull where the cerebellum and the brainstem are. These tumors can press on the mesencephalic aqueduct,
Okay.
which is that narrow channel that connects the third and fourth ventricles.
Right.
And any compression there can lead to obstructive hydrocephalus.
So location is everything when it comes to a tumor's potential to cause hydrocephalus.
Yeah.
Now, let's delve into the role of VP shunting in managing this. The article calls it the gold standard surgical intervention for obstructive hydrocephalus. Can you walk us through what makes this procedure so effective?
Sure. It all comes down to creating an alternate route for the CSF to flow. So a VP shunt is a system of catheters and a valve that gets implanted in the brain and body.
Okay.
And it allows excess CSF to drain from the brain's ventricles, bypass that blockage, and flow into the abdomen where it can be reabsorbed.
Good.
And this can provide remarkably fast relief from the symptoms of hydrocephalus.
Oh.
And in some cases can even extend survival time.
So it's almost like rerouting traffic around an accident.
Yeah.
Allows things to flow a little more smoothly.
Wait.
Now, before a vet even considers VP shunting, I imagine there's a lot of diagnostic workup that needs to be done.
Yeah.
What role does advanced imaging play in deciding whether or not this procedure is the right option for a particular animal?
Imaging is absolutely crucial, especially MRI.
Okay.
It gives us incredibly detailed pictures of the brain,
Right.
allowing us to clearly see if hydrocephalus is present and rule out other conditions that might be causing similar symptoms.
Are there any specific signs on MRI that point definitively towards hydrocephalus?
Yeah, there are a few key things we look for. One is periventricular edema,
Okay.
which is essentially fluid buildup around the ventricles.
Got it.
On an MRI, it shows up as bright areas surrounding the ventricles on FLIR images.
Okay.
Another telltale sign is enlargement of the ventricles themselves. So we assess the size and shape of the ventricles to determine the severity of the hydrocephalus.
So it's about looking for those subtle clues
Yeah,
that tell the story of what's going on.
right.
Now, the article also mentions the use of CT scans. How do those fit into the puzzle?
CT scans are really important for surgical planning.
Okay.
They provide those precise anatomical details that help surgeons figure out the best spot and angle for placing the ventricular catheter,
Okay.
which is the part of the shunt that drains CSF from the brain.
So the CT scans help ensure the procedure is as precise and minimally invasive as possible.
Exactly.
Now, the article goes into quite a bit of detail about the different components of a VP shunt: the ventricular catheter, the valve, and the distal tubing. Can you talk about some of the key considerations that go into choosing the right equipment for each patient?
Choosing the right shunt components is a critical part of the process.
Yeah.
Let's start with the valve.
Okay.
There are different types of valves available, each with its own mechanism for regulating CSF flow. The authors of this article seem to favor the Kadman Hakim fixed pressure valve system,
Okay.
as it operates at a medium pressure range, which aligns well with the normal intracranial pressure in dogs.
So it's all about finding that Goldilocks zone, the pressure that's just right.
Exactly. And this particular valve is also designed with a ruby ball that helps prevent clogging from protein buildup in the CSF, which is a common concern in patients with brain tumors.
We don't want the system to get jammed up.
Exactly.
Now, what about the other parts of the shunt?
Yeah.
What considerations are there when selecting the catheter and the tubing?
Well, the authors recommend a non-unitized shunt system for patients with brain tumors.
Right.
This type of system allows for more flexibility during surgery and makes it easier to replace the valve if it becomes obstructed, which, as we mentioned, can happen more often in these patients.
Okay.
And the choice of catheter and tubing length depends on the individual patient's anatomy and the specific location of the blockage.
So it sounds like customizing the shunt system to each patient's unique needs is really key to maximizing its effectiveness.
Exactly. And let's not forget the skill of the surgeon.
Right.
Implanting a VP shunt is a complex procedure that requires a high level of expertise.
Absolutely. Speaking of the procedure itself, the article emphasizes the importance of meticulous planning and execution to minimize the risk of complications.
Right.
Can you walk us through the key steps involved in implanting a VP shunt?
Sure. The procedure starts with the patient being carefully positioned and the surgical area prepped.
Okay.
The surgeon makes a small incision near the sagittal crest on the head to expose the skull. Then, using preoperative imaging as a guide, they drill a burr hole to access the ventricle where the ventricular catheter will be placed.
Wow, it sounds like incredibly precise and delicate work.
It is. The surgeon also drills a separate anchoring hole nearby, which is used to secure the ventricular catheter in place.
Okay.
Then, a separate incision is made in the flank to create an entry point into the abdominal cavity where the distal end of the shunt tubing will be placed.
So we have two separate incisions, one on the head and one on the abdomen. And now the surgeon has to create a pathway for the shunt tubing to run between these 2 points. How do they go about doing that?
They use a specialized instrument called a shunt passer.
Okay.
It's carefully inserted under the skin, starting from the head incision and advancing towards the abdominal incision, creating a subcutaneous tunnel for the shunt tubing to follow.
It sounds like it requires an incredible amount of skill and precision to create that tunnel without damaging any vital structures along the way.
It's definitely not for the faint of heart. Once the tunnel is established, the distal end of the shunt tubing is attached to the passer and pulled through the tunnel into the abdominal cavity.
Okay, so now we have the tubing in place. What happens next?
The surgeon then carefully inserts the ventricular catheter through the burr hole and into the ventricle, ensuring it's properly positioned. Once that's confirmed, they take a sample of CSF, connect the catheter to the valve, and the entire system is meticulously checked to make sure the CSF is flowing freely. The ventricular catheter and valve are then secured to the skull using that anchoring hole.
So there's a lot of checking and double checking along the way to minimize the chance of any problems down the line.
Absolutely. Finally, the incisions are closed, and a post-operative CT scan is usually performed to confirm the shunt is in the right position and functioning as expected.
It's amazing how veterinary medicine has advanced to the point where these complex procedures are possible. But even with the best surgical technique, I imagine there's always a risk of complications.
That's right. And that's exactly what we'll be discussing in part 2 of this depth dive.
From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging. We'll be back with part 2 soon.
So as we were just discussing, implanting a VP shunt is a pretty complex surgical procedure.
And like any surgery, it comes with inherent risks.
Right, exactly. And the article we're diving into today, it highlights some of the most common complications that can arise.
And I imagine those complications can be pretty scary for both pet owners and veterinarians.
Oh, they can be. But the good news is that with early detection and appropriate intervention, many of these issues can be successfully managed.
Okay, so let's talk about the different types of complications that can occur with VPP shunts.
Well, the article breaks them down into 3 main categories.
Okay.
Mechanical failures, functional failures, and infection.
Okay, so let's unpack those one by one.
Sure.
What are some examples of mechanical failures?
So mechanical failures, those involve problems with the shunt system itself.
So something physically goes wrong with the hardware.
Exactly. This could include obstruction of the catheter or valve, disconnection of the shunt components, or migration of the shunt from its intended position.
And I imagine these types of complications can be particularly challenging in patients with brain tumors.
You're right. Their CSF often has a higher protein content, which can increase the risk of the shunt becoming clogged.
So it's almost like a plumbing issue where the pipes get clogged up over time.
That's a good analogy. And in addition to protein buildup, friable tumors can shed fragments that could also obstruct the shunt.
So these factors need to be carefully considered when choosing the type of shunt system and planning the surgical approach.
Absolutely. Now let's move on to functional failures.
Okay.
What falls under that category?
Well, if mechanical failures are about the hardware, I'm guessing functional failures have more to do with how the shunt is working.
Exactly. A functional failure means the shunt system is intact, but not effectively regulating CSF flow.
So the plumbing's still in place, but the water pressure isn't quite right.
Precisely. One example is overshunting, where the shunt drains too much CSF,
Okay.
leading to a condition called ventricular collapse.
Ventricular collapse. That doesn't sound good.
No. What are the consequences of that?
Oh, I would imagine.
It can cause neurological symptoms similar to those of hydrocephalus, which defeats the whole purpose of having the shunt in the first place.
So it's a delicate balance, finding that sweet spot where this shunt drains enough CSF to relieve pressure, but not so much that it causes new problems.
Exactly. And then, of course, there's the ever-present risk of infection.
Right. Infection is a concern with any surgery, but I imagine it's particularly worrisome when we're talking about the central nervous system.
Absolutely. Infection within the CNS can have serious consequences, so meticulous surgical technique and prophylactic antibiotics are essential.
Now let's shift gears and talk about what happens when a shunt does malfunction.
Okay.
What are the signs that something might be wrong?
Often, it's a recurrence of the neurological symptoms that were present before the shunt was placed.
So the animal might start showing those same signs of hydrocephalus again.
Exactly.
Like lethargy, disorientation, or seizures.
Yeah, or the symptoms might be slightly different or less severe than before.
In any case, it's a red flag that something needs to be checked out.
Absolutely. The first step is usually a thorough neurological examination to assess the animal's current condition.
And I imagine imaging plays a crucial role in this process as well.
It's absolutely essential. Imaging allows us to visualize the shunt system itself and assess the ventricles for any signs of trouble.
So what are the go-to imaging modalities for troubleshooting shunt malfunctions?
We usually start with radiographs or X-rays.
All right.
They can help us rule out any obvious mechanical problems like a disconnected catheter or a shunt that has migrated out of position.
So it's a quick and non-invasive way to gather some initial information.
Exactly. But if we need a more detailed look at the shunt system and the brain, we'll turn to advanced imaging like CT or MRI.
And each modality offers its own unique advantages, right?
Yes, CT scans provide excellent detail of bony structures, which is helpful for assessing the position of the ventricular catheter.
And MRI excels at soft tissue visualization, giving us a clear picture of the brain, the ventricles, and any surrounding fluid buildup.
Exactly. So, depending on the suspected problem, we might use one or both of these modalities to guide our troubleshooting efforts.
The article outlines a systematic approach to troubleshooting shunt malfunctions,
Right.
emphasizing the importance of CSF analysis.
Right. Analyzing a sample of CSF obtained from the shunt's reservoir can give us valuable clues about what's going on.
What kind of information can we glean from CSF analysis?
We can look for signs of infection, like an increased number of white blood cells.
Okay.
We can also assess the protein content, which can be elevated in cases of inflammation, or if the shunt isn't draining properly.
So CSF analysis is like peering through a window into the brain's internal environment.
Exactly. And in some cases, we might need to go a step further and surgically explore the shunt system itself.
Now that sounds like a pretty invasive procedure.
It is. But sometimes it's necessary to directly visualize the shunt components, check for any obstructions or disconnections, and assess the flow of CSF.
Like a mechanic opening up the hood of a car to see what's going on under the surface.
A good analogy. During open surgical exploration, the surgeon might also try flushing the shunt system with sterile saline to clear any blockages.
So it's a multifaceted approach combining clinical observation, diagnostic testing, and hands-on problem solving.
Exactly, and it highlights the importance of having a skilled and experienced veterinary neurologist on your pet's care team.
Now, despite our best efforts, are there times when a shunt malfunction simply can't be fixed?
Unfortunately, yes. There are cases where the shunt system might need to be completely replaced or alternative treatment options explored.
The article mentions a procedure called a lateral ventriculostomy as a possible alternative.
Right.
What is that?
It's a technique that creates a new pathway for CSF to drain from the ventricles, bypassing the obstructed pathways.
So instead of relying on an external shunt system, we're creating an internal drainage route.
Precisely. It's not without its own risks, but it can be a valuable option in certain situations.
Now, throughout our discussion, we've been focusing on VP shunting as a way to manage the symptoms of obstructive hydrocephalus.
Right.
But I know the underlying tumor still needs to be addressed.
That's an important point. VP shunting is often just one piece of a larger treatment plan.
So it's like treating a symptom while also tackling the root cause.
Exactly. And the article emphasizes that VP shunting is often most effective when used in conjunction with other therapies like radiation, chemotherapy, or surgery.
So it's about using all the tools in our arsenal to give these animals the best possible chance.
Absolutely. And in some cases, VP shunting might even make those other treatments safer or more effective.
Can you give us an example?
Sure. Let's say an animal is experiencing severe neurological symptoms due to hydrocephalus, making it risky to perform radiation therapy. By alleviating the hydrocephalus with a VP shunt, we can potentially reduce the risk of complications during radiation.
So it's about creating a more stable environment for the other treatments to work their magic.
Exactly. And the article highlights studies showing that this combined approach, VP shunting plus radiation therapy, can significantly increase survival times compared to either treatment alone.
That's incredibly encouraging. Now, as we wrap up this part of our deep dive, I want to shift gears and talk about the potential benefits of VP shunting.
Okay.
We've touched on them throughout our discussion, but can you summarize the key takeaways for our listeners?
Of course. First and foremost, VP shunting can provide rapid relief from the debilitating symptoms of hydrocephalus.
Okay.
This translates to a dramatic improvement in the animal's quality of life.
It's about giving them back their spark, allowing them to enjoy life again.
Exactly. And beyond symptom relief, VP shunting can also reduce the anesthetic risk for subsequent treatments,
Okay.
like radiation or surgery.
So it helps pave the way for a smoother journey ahead.
Precisely. And while more research is needed in this area, some studies suggest that VP shunting, especially when combined with other therapies, may actually increase survival time in animals with brain tumors.
That's a beacon of hope in what can often be a very difficult situation. Now, as we transition to the final part of our deep dive, I want to leave our listeners with this thought. What if we could not only manage the symptoms of hydrocephalus, but also prevent it from developing in the first place? That's the burning question we'll explore in part 3. From vet neurojar, keep those minds inspired, hearts light, and tails wagging. We'll be back with part 3 soon. So we've spent the last 2 parts of this deep dive exploring how VP shunting can provide relief from obstructive hydrocephalus in animals with brain tumors.
And as we wrapped up part 2, we posed kind of a thought-provoking question.
What if we could go beyond just managing the symptoms
Right.
and actually prevent hydrocephalus from developing in the first place?
That's the ultimate goal, isn't it? To intervene early enough to stop this cascade of events before it even begins?
So let's talk about what we can do to move toward that goal.
Well, the article we're discussing doesn't specifically delve into preventative strategies for hydrocephalus in the context of brain tumors,
Okay.
but it does lay a foundation for understanding the underlying mechanisms that drive this condition.
So let's break it down.
Sure.
What are the key factors that contribute to the development of hydrocephalus?
Fundamentally, it's an imbalance between the production and absorption of CSF.
Okay.
And that imbalance is often triggered by a blockage in the normal flow pathways.
So if we could identify and address those blockages before they cause significant pressure buildup, we might be able to prevent hydrocephalus from taking hold.
That's the crux of the matter. And this is where the cutting edge of veterinary neurology comes into play.
So researchers are constantly pushing the boundaries, exploring new ways to diagnose and treat brain tumors. And some of these advancements hold promise for preventing hydrocephalus as well.
Absolutely. One area of intense focus is early detection. If we can catch brain tumors in their earliest stages when they're smaller and less likely to have caused significant damage, we have a much better chance of intervening effectively.
And what role is technology playing in this pursuit of early detection?
Advancements in imaging technology are absolutely revolutionizing the way we diagnose brain tumors.
So we're talking about things like MRI, CT scans, even newer techniques.
Exactly. We're seeing incredible progress in developing more sensitive and precise imaging techniques, allowing us to detect even the subtlest changes in the brain that might signal the presence of a tumor.
It's like having a much more powerful magnifying glass,
That's a good analogy.
allowing us to see things that were previously invisible.
And these advancements are not just about seeing tumors more clearly, they're also helping us understand their biological behavior, which is crucial for developing targeted treatments.
And what about treatment options? Are there any new approaches that offer hope for preventing hydrocephalus?
Yes. Alongside those diagnostic breakthroughs, we're also seeing some really exciting progress in treatment modalities. And one key area of development is less invasive techniques.
So procedures that are gentler on the brain and minimize the risk of complications?
Precisely. For example, stereotactic radiosurgery allows us to deliver highly focused radiation beams to the tumor, sparing the surrounding healthy tissue.
And what about surgical techniques? Are there less invasive options available there as well?
Absolutely. Minimally invasive surgical techniques are advancing rapidly, enabling us to remove tumors with greater precision and less trauma.
So it's a two-pronged approach. Early detection gives us a head start, and less invasive treatments minimize the disruption to the brain's very delicate structures.
That's right. And this combination holds tremendous potential for reducing the risk of complications, including the development of hydrocephalus.
Now, beyond these technological advancements, are there any other areas of research that offer hope for preventing hydrocephalus?
Yeah, one particularly exciting area is the field of molecular medicine.
So we're talking about targeting the very genes and proteins that drive tumor growth.
Exactly. This is the realm of personalized medicine where we tailor treatments to the specific genetic makeup of each individual tumor.
So no more one-size-fits-all approaches.
That's right. By understanding the unique vulnerabilities of a particular tumor, we can develop therapies that are more effective and have fewer side effects.
And could some of these targeted therapies also play a role in preventing hydrocephalus?
Potentially. For example, therapies that inhibit angiogenesis, the formation of new blood vessels, can effectively starve tumors of the nutrients they need to grow.
And by shrinking the tumor, we might alleviate any pressure it's putting on CSF pathways, potentially preventing hydrocephalus from developing.
That's the idea. It's a promising avenue of research, and I'm excited to see what the future holds in this area.
Now, while these technological and therapeutic advancements offer a lot of hope, there's another crucial aspect of preventing hydrocephalus that we shouldn't overlook.
What's it?
Raising awareness among pet owners and veterinarians. Early recognition of the signs of brain tumors is absolutely paramount.
You're absolutely right. The sooner we identify potential problems, the sooner we can initiate diagnostic testing and explore treatment options.
So what are some of the key signs that pet owners should be on the lookout for?
Well, the signs can vary depending on the location and type of tumor, but some common red flags include seizures, changes in behavior or personality, vision problems, difficulty walking or balancing, and head tilt.
These signs can be subtle, especially in the early stages. It's easy to dismiss them as just part of getting older.
But any unusual or persistent changes in a pet's behavior or neurological function warrant a trip to the veterinarian.
It's always better to err on the side of caution. Early intervention can make all the difference. Well, this has been an incredibly enlightening deep dive into the world of VP shunting for brain tumors. We've covered a lot of ground, from the intricate details of the surgical procedure itself to the broader landscape of brain tumor treatment and the exciting advancements that are shaping the future. I hope our listeners have come away with a deeper understanding of this complex condition and the unwavering dedication of the veterinary professionals who are working tirelessly to improve the lives of animals facing these challenges. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.